Hi everyone, welcome to the channel Medicine Explained. Let me ask you a simple question. When was the last time you checked your blood pressure? For many people, the answer is, I don't remember. And that's exactly why high blood pressure is often called the silent killer. You can feel completely fine, no pain, no warning signs, no symptoms, and yet inside your body, damage may already be happening. High blood pressure affects hundreds of millions of people worldwide, and it is one of the leading causes of preventable death. Today, we're going to talk about the 5 biggest risks of high blood pressure and why controlling it early can make the difference between a long, healthy life and a medical emergency that comes without warning. Risk number 1, heart attack. The first major risk of high blood pressure is heart attack. Your heart needs oxygen-rich blood to survive, just like any other muscle. That blood is delivered through the coronary arteries. When blood pressure is high, these arteries are exposed to constant mechanical stress. Over time, the inner lining of the artery becomes damaged. This damage makes it easier for cholesterol and inflammatory cells to stick to the vessel wall, forming what we call atherosclerotic plaques. As these plaques grow, the artery narrows. Blood flow decreases. And eventually, a plaque can rupture, forming a clot that suddenly blocks blood flow to part of the heart muscle. That moment is a heart attack. What makes this especially dangerous is that high blood pressure accelerates this process for years without symptoms. Many people experience their first symptom only when a heart attack already occurs. In other words, the damage builds quietly until it becomes loud and life-threatening. Risk number 2, stroke. Now let's move to the brain. High blood pressure is the single most important risk factor for stroke. Your brain is supplied by an intricate network of very delicate blood vessels. These vessels are not built to withstand constant high pressure. When blood pressure stays elevated, 2 dangerous things can happen. First, a vessel can become blocked by a clot. This leads to an ischemic stroke, where part of the brain is suddenly deprived of oxygen. Second, the vessel wall can weaken and rupture. This causes a hemorrhagic stroke, which means bleeding directly into the brain tissue. Both types can be devastating. Remember, be FAST, face, arm, speech, and time. A stroke can result in paralysis, loss of speech, memory problems, personality changes, or permanent disability. And in many cases, recovery is incomplete. What's especially frightening is how sudden it is. One moment you're fine. The next moment, your life has changed forever. And again, high blood pressure often does the damage silently, long before that moment arrives. Risk number 3, heart failure. The third risk is heart failure. Now, heart failure doesn't mean the heart suddenly stops. It means the heart is no longer able to pump blood efficiently enough to meet the body's needs. When blood pressure is high, the heart has to pump against increased resistance. To adapt, the heart muscle becomes thicker, especially the left ventricle. This is called left ventricular hypertrophy. At first, this seems helpful. A thicker muscle can generate more force. But over time, the thickened heart becomes stiff. It fills poorly. Oxygen demand increases. And eventually, the heart becomes weaker, not stronger. This leads to symptoms like shortness of breath, fatigue, swelling of the legs, and reduced exercise tolerance. Heart failure is a chronic, progressive condition. Once it develops, it often requires lifelong medication and significantly affects quality of life. And once again, high blood pressure is often the root cause. Risk number 4, chronic kidney disease. Next, let's talk about the kidneys. Your kidneys filter your entire blood volume many times a day. Inside them are millions of tiny filtering units called glomeruli, each supplied by very small blood vessels. High blood pressure damages these vessels over time. The filtration process becomes inefficient. Waste products begin to accumulate in the blood. This condition is called chronic kidney disease. The scary part? Kidney damage often progresses without noticeable symptoms until it is already advanced. In later stages, patients may need dialysis several times a week, or even a kidney transplant to survive. High blood pressure is both a cause and a consequence of kidney disease, creating a dangerous, vicious cycle. Protecting your blood pressure is one of the most effective ways to protect your kidneys long-term. Risk number 5, Aneurysms and vessel rupture. The fifth major risk is aneurysms. Constant high pressure weakens blood vessel walls, especially in large arteries like the aorta. Over time, a weakened section can balloon outward, forming an aneurysm. So aneurysm is a weakened area in a blood vessel wall that bulges outward under pressure. Most aneurysms cause no symptoms at all until they rupture. A ruptured aneurysm can lead to massive internal bleeding and is often fatal if not treated immediately. Think of it like a worn-out tire on a highway. You don't know when it will fail, but when it does, the consequences are sudden and severe. This is one of the clearest examples of why high blood pressure is so dangerous even when you feel completely normal. So let's recap. High blood pressure increases the risk of heart attack, stroke, heart failure, chronic kidney disease, and aneurysms and vessel rupture. The good news is this: high blood pressure is treatable and preventable. Lifestyle changes like regular exercise, reducing salt intake, managing stress, maintaining a healthy weight, and taking prescribed medications can dramatically reduce these risks. Checking your blood pressure regularly is one of the simplest health decisions you can make, and one of the most powerful. Because when it comes to high blood pressure, what you don't feel can hurt you. Thanks for watching. If you found this helpful, consider liking the video and subscribing for more clear, science-based health content. Take care of your blood pressure, and your future self will thank you.